think of great things that you can do, but understand that the reason why you're doing them is out of love, and to approach every one of your patients with that love.
Vicki Chan-Padgett is a retired Air Force colonel, and she's made a very smooth transition from service to country to a much broader impact on service to humanity.
I arrived at the Shade Tree 4 years ago, and at that time the ambulance was arriving about 6 times a day to take women or their children to the emergency room to receive medical attention.
I went to her and I said, Marlene, what do you need? She said, you know, Vicki, we need a clinic.
The residents of the Shade Tree had already suffered so many different kinds of injustices, and medical care wasn't going to be one of those injustices in Vicki's book.
She's developed, through basically her own determination, a clinical facility, the only clinical facility that I know that's a free clinic in a woman's shelter in the United States.
I never in my wildest dreams thought we would have more than a dozen providers with us, and now 4 clinics a week to meet the needs of the women and children that are living at the Shade Tree.
She cares and so lovingly stares into your eyes and say, you know, what's going on? How are you today?
I feel better, and I feel better about myself, and I appreciate you.
Allison.
The Stallman Toro Health Clinic is here specifically because Vicki Chan-Padgett saw it in her head and her heart and made it happen. I wouldn't have been able to do that, and in the 19 years I've been doing this work, no one else even tried.
She also has expanded her horizons to the international world. Each year, she and her husband have traveled to Thailand on a humanitarian mission.
The refugee population that we serve in Southeast Asia is on the Thai-Burma border. The Karen are being ethnically cleansed slowly and certainly by the Burmese military junta.
It's a horrible situation for the Karen, but the Karen people are just so wonderful and so positive and determined to survive. But what they needed was their own medical providers.
She met with us and said, you know, the only way to really affect change here is by training the indigenous people with the skills that we have.
With our program, we've actually seen what can happen. The first class graduated 2 years ago, and they are now the medical officer in their village. They are teaching other medics how to diagnose, how to think clinically. It's so heartwarming to see that happen and to help a nation survive.
Vicki is a unique, courageous, and talented woman who has been able to improve the quality of medical care for an entire ethnic population through her dedication and hard work and refusing to accept defeat in any of the areas in which she works.
I want to take away part of their burden just for a little while. I want to give them that kindness and that respite for them. I want to educate them. I want to give them tools so that they can be successful or survive. And I think on my last day, I can look at God and I can say, you know, I did some good. I did some good in this world, and I can go happily.